this is why we think. We got the killer T cell. This is how this works. This is a picture of how your T cells see if there's a virus hiding out inside of one of your cells. It has to, in the way we describe this to patients, the class 1 MHC is a hot dog bun, and the peptide is a fragment of the virus, and it's like a hot dog. We have a hot dog bun presenting on the surface of the cell a hot dog, and basically that flavor is a 1 in a billion flavor that the T cell can detect. We literally have a billion different flavors of T cells in our body, and any given T cell has one T cell receptor that has a single type of a tongue, basically. It's a miracle of how the immune system works. But one way that the cancer can hide is to downregulate the hot dog buns. Get rid of the MHC molecules. It's been described in other cancers before, and it would make sense, and we had some hints. So we looked at these cancers, and sure enough, about half of them still had lots of this brown class 1 MHC hot dog bun on the surface of the tumor cells. But these guys, about a third of 114 of these cases had really lost it in some areas, and 1 in 6 Merkel cell carcinomas had no hot dog buns on their surface, meaning there was no way a T cell could see it or what was inside it at all. So this presented a huge problem because they're totally cloaked in Star Trek speak. You know, they've got their force field on and they are invisible. So this stops us from generating immune responses and from treating them with immune therapy. So we wondered if this was reversible, and that turned out to be the case with interferons. Part of what we feel when we have a cold is the effect of interferons being released. It gives us the shakes and chills and such, and this turns on a lot of antiviral effects, including upregulating MHC, which is also called HLA, the hot dog buns. And we showed that, sure enough, in the laboratory, with 5 different lines of Merkel cell carcinoma, we could markedly upregulate hot dog buns, make them visible to the immune system, essentially. And then we could do that in a dose-responsive way. So in the lab, we could do it. More importantly, we could do it in a human. And this, Kelly found this paper buried in the Japanese literature about a 62-year-old woman who was treated only with interferon, which is a approved drug, injected into the skin, for example. And she had a bunch of metastases up and down her arm, and they were injected with interferon, and not treated with anything else, no surgery, no radiation, no chemotherapy, and she went 8 years without a recurrence. How did this happen? Kelly said, I think it's from immunology. And we got these slides from Japan. We collaborated with the Japanese group. And so here is the Merkel cell cancer on the usual stain. Here's the cytokeratin 20 stain that makes the little brown dots, so you know this is all Merkel cancer, and this is normal tissue that surrounds the cancer. Here are hot dog buns, MHC, all over the stroma and none on the tumor. And then here are CD8s, no brown cells at all. So we basically have no invading T cells, and that's not a surprise because there's nothing for them to see. Here, 2 weeks after treatment, loads of class 1 MHC, the hot dog buns, and lots of killer T cells infiltrating, which is totally associated with survival. So we then treated a couple patients. So we now treated 10 patients in Seattle with this. It's an FDA-approved approach. And here's one woman with a Merkel cell carcinoma on the finger, treated with 13 days of interferon before she got her standard treatment with surgery and radiation. This was just an add-on treatment, essentially. And here's what her tumor looked like before and after interferon. Happy nodules of cancer at low power and high power, all these cancer cells. And then here, after interferon, this is all dead tumor. And smaller, little bits of tumor still left, but much smaller. And then more importantly, here's class 1 MHC, the hot dog buns. There's no way for T cells to see these cells that have none of this brown on them. And then after the interferon, there's a huge induction, great ability for the T cells to see them. And then sure enough, loads of T cells come into the tumor and presumably are helping to defeat the cancer. So we treated a number of these patients. We've had 5 complete responses, 5 partial, 1 with disease progression who was then rescued with radiation and has done extremely well. We don't think this is sufficient, but it's a step in the right direction. Here's a patient who had 2 of these lesions injected with interferon, and they all responded. Here's after interferon, before he went on to get radiation. They all responded. Here are the 2 that got injected, and you can see all of the others are gone as well. We're not ready to trust this and leave it at that alone, but so we radiated as well. He's doing very well. But we think we're on the right track. So we are really excited about immune therapy in this cancer, doing interlesional interferon, as I told you about. There's a very exciting trial where we're putting in a hormone using electricity, zapping the tumor to make the DNA go into the cancer cells and produce this interleukin 12 hormone right in the cancer. And then what I want to tell you about last is isolating cells that can kill this cancer specifically and infusing them into a patient. So here, I'm just going to tell you, we found a bunch of those T cells with the specific ability to find and kill virus-infected cells. I'm not going to go through a lot of detail, but here are 26 of them that we found, 26 flavors of T cells all throughout the part of the virus that drives the cancer and is necessary for it to grow in an ongoing way. We then made some special tools called an MHC peptide tetramer that is basically a specific hot dog bun combination and allows you to pull out any given T cell. And then you're going to ask, well, if these patients have T cells that can kill this cancer, recognize the virus and potentially kill the cancer, why is the cancer growing in them? So again, we believe that in many cases the MHC peptide is gone and there's no target. And we can reverse that, as I told you, not only with interferons, but also with radiation. This will be important in a moment. We can give a low dose of radiation and cause those hot dog buns to come up and make the immune system be able to see the cancer again. So now I'd like to tell you about this one case that puts it all together. The dream of somebody doing what's called translational research, linking the disease with the research over 18 months, the past 18 months. So this is a patient who had one small Merkel cell carcinoma on his hip. Like many of our patients, he came from Texas to get seen here and treated. And we got some of his tumor tissue, then isolated some virus-specific T cells from his tumor. And here is his antibody level. Okay, it goes down initially, great. But then it stays steady. It's a little worrisome. Then it starts going up. So we worry, is his cancer coming back? And he's a patient who didn't have anything in his lymph node. We looked under the microscope. There's no cancer there. A low-risk patient. Wouldn't normally do scans on him. But because of this increasing antibody, we said, okay, let's get a scan. So sure enough, he's got a metastasis near his pancreas. And it's about 1 inch in diameter, 3 centimeters or so. So then collaborating with Cassien Yi and Aude Chapuis, we started making T cells. We had already been studying the T cells, but we said, hey, we could treat him with these T cells. Cassien already had a trial to use this for other types of cancer. We just needed to substitute a different disease. So that was straightforward. Unfortunately, he continued every month to get a new metastasis, basically, and they grew. But he was asymptomatic. He felt totally fine. We wouldn't have known about this yet if it weren't for the antibody test. And in a remarkable sort of 6 or 7, 8 months or something, we went all the way from finding T cells to preparing T cells and beginning to treat. But first I have to tell you how those T cells were made very briefly. In his blood, 1 in 1,000 of his T cells could recognize and kill this cancer, and they were stunned. They were silenced, and they couldn't be turned on. If you challenge them with a piece of the virus, they would roll over and say, I ain't doing nothing. We could grow them out, enrich them in a variety of different ways, and went from 1 in 1,000 to 86% of T cells in the laboratory were both functional and specific and able to recognize and kill virus-infected cells. And we made 23 billion of these T cells that could then be infused. But recall, there was a problem. His cancer had no target. Sure enough, we looked, and this is what his cancer looked like. There's almost no class 1 MHC or hot dog buns or ability for the T cell to recognize the target. So we had to do something called a preconditioning and wake up his class 1 MHC before we gave him his 23 billion cells. So the first way we did that was collaborating with Juha Huang, who put a tube down his throat, made sure this was Merkel cell cancer. Here's a little picture of it on an ultrasound, and did a biopsy. And sure enough, it was Merkel cell cancer. And then he spritzed a little bit of that interferon, stuff that we make when we have a cold, into one of these lesions. And then we infused T cells for the first time. And the second time, Upendra Parvathanani, our radiation oncology friend and colleague, gave a little bit of low-dose radiation one time to upregulate class 1 MHC. And so then, sure enough, the cells stayed in his bloodstream. That's very important. Here's several weeks out. And here, the cell number, I won't belabor the details, but over these several weeks is about 20 times higher than it was at baseline. And they function. Here, they're dead to the world when you try to tickle them and wake them up. And when we put the T cells into him here at day 0, he had big function. He would make the kinds of things that say, I'm awake and I'm ready to kill a target cell, interleukin-2 and such. And then here is what he looked like beforehand. There's a PET scan in 3D. The brain and the heart and the bladder all look black because they take up a bunch of glucose, but the cancer was here. A couple foci, one that's an inch, one that's another, less than an inch there on the side. We gave him the 2 infusions of T cells and the low-dose radiation and such, and you can see the cancer is much smaller. He didn't have essentially any side effects. Instead of having a new metastasis every month, he has not developed any since that time. And we just treated him with his 3rd infusion. He still does have some residual disease, and we're still thinking, how are we going to attack this? The game is not done, but it's huge, exciting progress. So what's next for Merkel-specific T-cell therapy for patients? We've gotten a small grant from the Bezos Fund to treat 4 more patients. We're preparing a bigger grant to treat a larger number, and we're trying to expand. Right now, we could only offer this treatment to about 1 in 10 of the patients that come along because of the flavor of their hot dog bun. So we want to get a bigger variety of hot dog bun potential therapies, and that's well on the way. So I'd like to thank, again, collaborators, some of the people that carried out this work. And I told you I'd do 3 stories, and then now I'm gonna show you this video that encapsulates the problem. 90% of research grants are not getting funded now. And most taxpayers are who ultimately support research, and they're not aware of what good is coming.